Hi, Matt and Naomi here from Active Therapy South. So today we're talking low backs. It has been a couple of weeks now and Matt has been diligently colouring in with the kids. He's got a low back problem. So it's really important that we give him a little routine to stretch things out. Here he is. He's been enjoying the colouring in. So the first thing we're going to get Matt to do to help release his low back is to do some lumbar mobilisation. So get him to stand up. Always a good idea to have regular breaks from your desk. I'm going to go side on to Matt. So we want to do some lumbar mobilisations. Going to get Matt to put his hands on his hips and he is going to extend and flex the back by tilting the pelvis. Okay, so it's just pelvic tilts one way and then the other. So if he's regularly doing this, it's just going to get his spine ready for more progressive movements. Okay, I know it sounds really simple, but it's a really important movement to practice. Once Matt has done the pelvic tilts, he is going to do some forward bending to reduce the compressive forces that he's been experiencing. So it would be a good idea if he has any vulnerability in the back to use a chair to begin with. Okay, so as he's bending forward, he might stabilise using a chair just to make sure that there's no chance of spasm or anything as he comes up. So this flex position is offloading the lumbar joints, reducing some of that compression he's been feeling while he's been sitting. And he's going to come upright, so he's going to repeat that a few times. Obviously, if he feels confident and there's no vulnerability, he can do it without the chair. That's it. So really nice stretch, tucking the chin under as well, really feeling that stretch the whole way through the back. Again, set your alarm regularly if you're at the desk all day long to be doing this. Once an hour is ideal.
Okay, another thing to add to that would be that the tendency is, imagine you're getting out of a car after an 8-hour drive. There's a tendency to kind of submit to the position that your back's been in, so you lean backwards. That's what Naomi's just said there. It's so important to lengthen the muscles front ways. So when you get out of your chair, try not to submit to that initial ache by leaning into it, because then you've got more work to do. So following on from what Naomi said there, we want to look at wringing these muscles out. So from the base of your neck, they're called the rectus spinae muscles, from the base of your neck running right the way down to your sacrum. They actually hug the spine all the way down. So what we're trying to do here is lengthen, ring, and lengthen again, which will give you the best release possible. Okay, so following on from what Naomi said there, I'm now going to lie on the floor, and this is what I want you to do. You can either get a yoga mat or just a cushion, a couple of cushions, and lay back. Okay, so the thing to remember with this point, this position, is when you're bringing your knees to your chest, don't naturally feel the tendency to yank the knees in when I'm saying pull the knees in. It's all about the breathing, so just focus on what I'm doing here. Okay, so bring your knees in naturally, link your fingers and just rest. And then all you need to do is take a deep breath. And just bring in about 20% of the pull. So don't, like I say, yank, because if you yank the knees back, watch what happens to the low back. It tightens and flattens and tightens the hips, doing the absolute opposite of what we're trying to achieve. So it should all be very passive. So a deep breath. Pull in about 20%, wait until it starts to tighten up again. And then you should get to a point that it starts to roll rather than flatten, okay? Once you've done this 4 or 5 times, just let the knees come to rest, okay? Link your fingers again. The point of this exercise is to keep everything from the rib cage up as flat as possible, okay? Imagine somebody stuck a piece of sellotape between your knees and let your knees go over to one side, okay? Trying to keep from here flat, remember? Okay, deep breath. And you'll see that they'll go. When you take the deep breath, it lengthens the muscle very slightly. So when you release them, it's got that chance to go a bit further. Lengthen, go a bit further. Again, this is all passive, it's all gravity based. When you get to the point where you feel that your legs won't go anymore, maybe 5 or 6 breaths, what I don't want you to do is this, because you'll tighten your back up again. Stay where you are, flick the legs out, return to normal, and then you've not tensed any of those muscles up that you've just spent 2 minutes releasing. Okay, same again to the other side. 5 or 6 times, flick your legs out, bring them back in, one last roll of the back, over to one side, and bring yourself up to the standing position. Okay? There you go, low back release.